I think that the virtuous legislature would say, we don't need your money because we can cut here. We could have put off, we could have sold the state car fleet and leased cars and put off purchasing, releasing cars and saved several $1,000,000. Those are the things you do. You clean up your own house. We don't need to be taking money if we don't need it. We don't need the strings attached.
Well, I'd like to see the figures where cleaning up our car fleet would take care of those deficits. Where else is the fat that you would cut?
Where else is there? There's a lot of administrative things that could be, well, okay, AEA. Des Moines Register article in 2008 said, how come we have 75 leaders now in our AEA? Why are we spending all the money on new directors of AEA? Is that because of No Child Left Behind? If so, let's leave No Child Left behind. It's an unfunded mandate from the federal government, and that would save our schools a lot of money. So there's a budget saving measure right there. There are other things that can be done. We need to start putting sunset clauses before we start a state program. A sunset clause means this program is good for 5 years or 10 years or whatever sunset provision we want to put in here. The problem with government programs is once they get started, they never get eliminated, and they just grow and they grow and they grow and they grow. We need to put sunset clauses in there so that the legislature proactively has to reauthorize those. Because by doing so, it brings up the public debate once again whether that's a viable program.
What programs would you like to see have a sunset on them?
Any new programs that the state expends money on.
So the Hawkeye program that provides medical services to our children, you want that to be sunset?
Yes, I sure do, because by going through a review process, we might find out that the Hawkeye program isn't working the way it is designed, and we can design a program that would work. By just letting them go and never renewing them, they never get updated.
I disagree.
Well then, I guess at this point it would be a good time to work into a little bit of healthcare questions. Mr. Shaw, you insinuated that the Hawkeye program is not working adequately or as it's designed, is it?
No, I did not say that. I said, for example. She brought up Hawkeye. I said, for example. By putting a sunset clause in there, the legislature would be forced to review that program and make sure that it is running well. At that time, they could defund that program and start another program that maybe is more efficient, provides better service and less expense to the taxpayer. That's the purpose of the sunsets.
Susan?
I think I stated I disagree. I don't think there's a thing wrong with it. I haven't read any study that shows any waste in that program, and it helps keep our children healthy. We're a model for the rest of the nation.
Well, you're insinuating that I'm trying to eliminate the program, and I'm not. All I'm saying is when you put a sunset in there, what happens with government programs? I've been in government service for a long time. I spent 20 years in the Navy, and let me tell you how the government works.
I'm saying, Tom,
somebody gets a task assigned to them, so the first thing they want to do is they want to create a report. And now they have all these people sending them reports. They're getting so many reports that they can't keep up with them and answer the phone at the same time, so now they have to hire an assistant. Now the phone keeps ringing and the mail keeps increasing, so now you've got yourself, you have your assistant, now you need to hire a receptionist. That is how government grows and grows and grows and grows, just like bureaucracy in large corporations. When that stuff happens, every now and then, you need to sit back, take a deep breath, and give a logical review of that program. If it is working fine, great, reauthorize it. But if you're finding problems with it before you reauthorize it, it gives you the opportunity to correct those errors.
But the problem is, what I'm getting at, I don't mean to harp on the Hawkeye program, but if not that program, what other programs you would cut?
I haven't talked about cutting any programs.
What other programs you would allow to sunset?
Any program that
I mean a
receives state-
specific program. And how much money would it save us?
The iJobs program, I want it sunsetted tonight.
I don't think that would be the best interest of the state of Iowa.
All right, we'll move on. And we'll continue in a little bit of a healthcare theme. This question also comes from a submitter who requests a bit of anonymity. I ask if they want their name attached to the question, they get a yes or no option. I'd rather have the
My response
question.
will be anonymous.
What do you see as the important aspects in ensuring that healthcare will continue to be available in our many rural settings across Iowa? Susan?
Well, the Hawkeye program for one. I think, yeah, rural Iowa is very underserved in healthcare. One of the initiatives that I would support is called the Iowa Initiative, and that is a program that is collaborating with the public health programs that we already have to offer counseling and funding for women who don't want unintended pregnancies. That program saved us millions and millions of dollars each year, and exactly, I can find the exact figure, I shouldn't say millions and millions, but it would save us millions of dollars in health care and in social services.
Tom?
The one thing we need to do is continue to support our local community hospitals. Pocahontas is a community hospital. It provides a well-needed access for medical care, a primary stop. I know in law enforcement, when we have accidents, it's an excellent place to get a patient stabilized so we can wait for life flight, and then we need to make sure we keep take care of our community hospitals. I actually have received the support of the Iowa Hospital Association, and they represent about 120 community hospitals throughout the state. Some of the things we need to look at to help support our local hospitals is tort reform. It's gotten to the point where we've all heard the horror stories about every doctor getting sued and obstetricians wanting to leave their practice because they can't help, they cannot afford the malpractice insurance. It's gotten so bad now that all of the nurses are starting to get sued for poor services. That just drives up costs to the local community hospitals. It finds that it's harder for them to hire nurses and doctors. Like here in Pocahontas, they have doctors come up from Des Moines, maybe even Sioux City. They come up here and work for 2 or 3 days and then return to their parent hospital. If we don't reform our tort laws, then we're just going to drive them out of business.
I agree we need to support our local hospitals, and I've been to several meetings with one here in Pocahontas with the hospital administrators and one in Algona. And the one lucky thing that's already happened is the payments that Iowa hospitals get for Medicare. We were dead last. I think we were even behind Puerto Rico in our reimbursement rates. Because Iowans are so efficient, we were penalized for giving efficient care, and our payments were significantly less, and that was dooming many of our small hospitals. That situation has been corrected, and so that has been a very big help. Another place where we need to include in healthcare is mental health issues. We're something like 48th lowest in the nation for the number of psychiatrists, 47th in the nation for psychologists. It's a terrible, terrible problem. I know when you have a mental health situation, the doctors have to spend hours calling around trying to find a facility for this person that's experiencing mental health problems. in many cases, it becomes a law enforcement issue. The people are hauled away in a police car, handcuffed, instead of getting the proper mental health care that they need. So that is a huge issue also.
I fully concur with your comments on mental health. We're in dire straits up here in northwest Iowa. Lack of facilities, as she has said, it's a law enforcement issue. Our current directive, when we have somebody that needs to be involuntarily committed, which you have to do sometimes to make sure they get the treatment, our option, or per state code, is we're to transport them to the nearest hospital, which is Pocahontas Community Hospital. What ends up happening is we tie up 3 or 4 peace officers for hours on end. We tie up the hospital staff there while they're trying to find a bed to put this person. It ties up the sheriff's office because sometimes we have to transport as far as Sioux City. I remember one night the sheriff's office had to transport an individual all the way to Sioux City. And then you turn around a day later, they have to go to Sioux City, pick up the individual, bring them back for a 5-minute court hearing, and then transport them back to Sioux City. We've got to come up with a solution. And as you can see, with all of these questions, we have plenty of problems to try to focus on and to tackle. And there are no easy solutions. And I try to tell folks I don't have a magic wand. I don't have any magic beans. But I think collectively, as Iowans, we can resolve these problems.
All right. Last year, the Iowa Supreme Court made a unanimous ruling that an Iowa law defining marriage as a union limited to a man and a woman was unconstitutional. It noted that the law's definition violated the equal protection guarantees. As a result, a concerted effort is being made this fall to unseat 3 Supreme Court justices who are up for retention this November. Political contributions in the retention elections are approaching a record that will likely be surpassed this election season. Do you feel the retention of justices should be the decision of the public? And what system do you feel will produce the most reliability in ensuring the competency of Iowa's judges? Tom?
Well, this is certainly the hot topic of the day, not only in Iowa, but across the nation, not only with our Iowa Supreme Court justices, but some other federal circuit court justices. I absolutely do believe that the justices should be up for retention and that the people should have the opportunity to vote yes or no on retention. Somehow, over the years, it's been perpetrated upon us that the courts are a separate part of the government and they're not accountable to anybody. And they sit up there arrogantly like you can't touch us and you can't do anything to us. They are one of 3 co-equal branches of government. And they serve at the consent of the governed, just like a legislature, just like our chief executive, the governor. They need to be held accountable just as much as any other government official.
Yes, I agree that they need to be held accountable, and that's why we've got the system in place that, yeah, you vote how you want to vote. You want to retain the judges or not. I agree with Tom on that point. I think we're the envy of the nation once again because we Iowans use common sense. And if we don't like what's happening, we can go to the polls and vote it down.
Well, we can't vote down the issue of gay marriage because the Democratic majority will not let the people vote.
Oh, I'm happy to address that. I think we can't go around changing our Constitution because we don't like what's happening. I would not do that lightly at all. I mean, think about California. Proposition 19, Proposition 27, Proposition whatever. Now they're up into the 100s because they're trying to cure all their social problems by passing an amendment to their Constitution. I don't think we should be messing with our Constitution.
So let me get this straight. Our Constitution, our federal Constitution says we the people